Assalamualaikum warahmatullahi wabarakatuh. I'm Ahyani Junia Karlina. Here I will tell you about coronavirus. Coronavirus. Until the middle of March 2020, according to data from the World Health Organization, the number of infection is around 250,000 cases, with more than 10,000 deaths, according to data as of Friday. The three countries with the most cases outside China where the plague originated are South Korea, Iran, and Italy as of March 19. China, for the first time, had not experienced a new case of COVID-19 in Wuhan, the first city to develop a coronavirus. Indonesia is not the country with the most cases, but has the highest fatality rate of around 8%. When the coronavirus began to spread rapidly in China in the last week of January 2020, we raised various questions around the outbreak, including the spread and whether the affected can be cured. The symptoms of COVID-19 are similar to those of a cold or flu. At first, sufferers feel like a fever and then followed by a dry cough. After 1 week, the patient will experience shortness of breath. The incubation period between transmission and showing symptoms is about 14 days, according to the World Health Organization, or WHO. But some researchers say this period can take 24 days. Chinese scientists say some people may be infected before showing symptoms. The doctor, who is a member of the Indonesian Lung Doctor Association, confirmed that all coronavirus include the 2019. Okay, here I will explain how the coronavirus is transmitted. 1. Hand contact with an object being touched can cause us to contract coronavirus because in general the coronavirus can survive up to 3 days by sticking to the surface of object. Number 2, not keep hands clean because the hands of various disease. Therefore, we must wash our hands often. Number 3, not applying the ethics of coughing and sneezing. If we are coughing or sneezing, we have to close our mouths because the coronavirus is contagious because of human saliva. Number 4, interaction occurs with many people. This is very dangerous. We don't know whether someone has contracted coronavirus. Then, don't interact with many people. Number 5, no self-isolation after return from the infected area. Steps and efforts of the Indonesian government to deal with corona. 1. The government of Indonesia has formed and activated the Rapid Mission Team in the area of the authority of the state's entrance at the airport, or state cross border post. The team can consist of Port Health officers, immigration, customs, animal quarantine, and other relevant units in the area of the entrance authority of the country that have the competence needed in in preventing the importation of disease. 2. The team is tasked with supervising transport equipment, people, goods, and the environment. At the entrance of the country provide interview space, observation room, and quarantine room for passengers. 3. In the face of the COVID-19 pandemic virus situation since January, Indonesia has conducted health checks at around 135 points at airports on land and in ports, using body temperature scanner for anyone entering Indonesian territory in accordance with international health regulation. The government of Indonesia has also deployed additional personnel at the airport and increased hospital preparedness. Number 4. The government, through the Ministry of Health, has taken 3 steps to prevent the entry of coronavirus into Indonesian territory, namely issuing circular to all provincial and district or city health office, referral hospital, port health office, and environmental health and engineering centers to increase alertness and preparedness in the face of possible entry of this disease. Placing 135 terminal scanner in all airports in Indonesia, especially those that have direct flights to China. Provide health alert cards and communication, information, and education to passengers. Number 5. The Ministry of Health has also appointed at least 100 referral hospitals which were actually used in cases of bird flu. In addition, the Ministry of Health has also prepared 21 evacuation capsules related to the spread of the coronavirus as a form of prevention. Number 6. The Ministry of Health has developed preparedness guidelines referring to the interim guidelines compiled by WHO. Number 6. The Ministry of Health has developed preparedness guidelines referring to the interim guidelines compiled by WHO. Compiled guidelines on how to reduce the risk of contracting COVID-19, such as washing hands and avoiding people who are sick and ensuring appropriate steps have been taken. These steps are good as a form of prevention and anticipation. Number 7. The Ministry of Health Open Service contacts that can be us. The Ministry of Health noted on Monday the Wales there 1,017 additional new cases of the coronavirus. Most additions occurred in East Java, 270 cases, Jakarta 142 cases, Central Java 116, and South Sulawesi 101 cases. While in the previous days when a record of additional daily cases occurred in East Java, South Sulawesi, and Jakarta. The government, through its coronavirus spokesman Ahmad Yuryanto, said at an online press conference on Monday, the addition of this case is the result of massive and aggressive contact training.